If your knee hurts on the inside when you run, many people immediately think it's the meniscus, but for runners, it's often something else. Do 3 quick tests with me, and by the end, you'll know the most likely cause behind your inner knee pain. Stand on one leg and go into a half squat. Alternatively, you can also do a lunge. Now place your fingers on the inside of your knee right next to the kneecap. If the squat causes pain exactly underneath your fingers, make a mental note. And now let's check for another possible cause of inner knee pain that even doctors overlook. And for that, we'll do test number 2. Sit down with your legs straight and gently push your kneecap towards the midline of your body. Keep the pressure there and then bend your knee to about 90 degrees. The test is positive if the pain disappears or becomes much less at about 90 degrees of knee flexion and then increases again when the knee is straight. Remember the result of test number 2, we will evaluate it in a moment because there is a third possible cause that doesn't show up on MRI or ultrasound. Now let's check that with the third test. For this one, stand barefoot or in socks in front of a large mirror. If you don't have a mirror, simply look down and watch your legs directly. And now slowly go into a single leg squat again, just like before. Repeat the movement a few times and pay attention to the following points. A. Does your knee move inward towards the center of your body? B. Does the opposite side of your hip drop down? And C. Does your thigh rotate inwards? If you can clearly see one of these or notice several of them slightly, test number 3 is positive. Let's now evaluate the test results and then I'll show you simple exercises that work very well for these problems and what you can do if none of the tests was clearly positive. If test number 3 was positive for you, this doesn't just affect the knee in the long run because this movement pattern also changes how load is distributed through your lower body, and it can also contribute to problems in the Achilles tendon as well as the sole of the foot. Specifically, we just tested for dynamic valgus, meaning the knee collapses inward towards the center of the body under load, and when that happens, more pressure lands on the inside of the knee with every single step. Pain then appears long before you would see any changes on an MRI, and many people feel it on the inside of the knee right next to the kneecap. And this alignment issue can also influence the result of test number 1, but it usually improves very well with the exercises I'll show in a moment. If test number 2 was positive, you might also feel a cord-like band under the skin right next to your kneecap when your knee is bent. It may hurt when you press on it and snap when you bend or straighten the knee. And that points towards medial plica syndrome, an irritated fold of tissue inside the knee joint that rubs along the inner side of the kneecap. Typical symptoms are a sharp or rubbing pain right next to the kneecap towards the inside of the knee, often accompanied by snapping or grinding when bending or straightening the knee. In test number 1, we checked for pain on the inside right next to the kneecap, and if this test was positive for you, it could be patellofemoral pain syndrome. People often feel it around or behind the kneecap, but it can also be perceived more on the inside of the knee. Typical triggers are climbing stairs, running downhill, or sitting for a long time with the knee bent. If you get knee pain from running, I'm sure you've also heard or read about changing your running technique, but in large studies involving thousands of runners, only 2 technique changes actually help, and I show those to you right after the exercises. Now, if none of the tests was clearly positive for you, 3 other causes of knee pain are often responsible, and I explain those in detail in another video. Many runners with knee pain make the mistake of simply running less and trying to wait it out. And if you're lucky, that's enough, but it often doesn't solve the problem, and then pain comes back eventually. So let's look at 3 proven corrective exercises, and after that we'll talk about what you can change in your running to prevent pain in the future. We'll start with an exercise that often reduces pain right away, then we'll look at the most important strength exercise for this type of inner knee pain, and finally I show you a movement that you need to be able to do if you want to run pain-free again. For the first exercise, you grab a broomstick or another stick and then you massage your muscle, your thigh muscle, like you're rolling out a piece of dough. And this relaxes the muscle, takes tension off the knee, and helps the irritated tissue come down. And some of my readers immediately notice a clear reduction of pain just from this alone. But that alone isn't enough, so we'll move straight to an exercise that many runners struggle with, even though it's very important for healthy knees. Stand sideways next to a wall and support yourself with your arm. Now let the hip on the side away from the wall drop down. Then raise the hip again while actively pressing your hand into the wall. The important part is that the pressure comes from your shoulder and back and not just from your hand. So the idea behind this exercise is simple. If your pelvis drops while you're running, more pressure will be placed on the inside of the knee and the kneecap won't track as well, leading to pain. And with this exercise, we're training the exact muscles that prevent this pelvic drop. And that's especially important if your knee also collapsed inward during test number 3. We'll talk about the recommended repetitions in a moment, but first let's look at exercise number 3. For this one, you stand on a stair step and gently touch the step below with your heel. You keep your knee aligned over the middle of your foot throughout the entire movement, and this strengthens the hip stabilizers and thigh muscles, which helps you run with less stress on the knee. Two evidence-based changes in running technique that can also help with that are number 1, taking softer steps, and number 2, increasing your cadence by about 5 to 10%, which simply means shortening your stride length just a bit. And this reduces the force that acts on your knee with every single step. Now, briefly about the repetitions for the exercises, and after that, I'll show you a model that explains why so many runners keep getting the same knee pain again and again. For the massage, about 1 minute per muscle group is enough. For the hip hike, I would start with 3 sets of about 15 repetitions, and you might be surprised how strongly you feel your hip working there. For the step down, it should be fewer repetitions, for example 3 sets of 8 slow reps, so the tissue doesn't get overloaded again. And this gives you a solid starting point to recognize the most common causes of inner knee pain while running and to work on them in a targeted way. And with adjusted training loads and regular exercise, many runners notice a clear improvement within about 4 to 6 weeks. But patellofemoral pain almost never has just one single cause. Here's a model of all the triggers behind it. Knee pain often starts here, for example, through muscle imbalances, limited mobility, or training errors. And in the end, everything converges here in patellofemoral pain. And for this overview alone, I analyzed nearly 300 studies just about patellofemoral pain syndrome. And in my book, The Knee Reboot, I turn all that research into a clear step-by-step plan so you know what causes the pain, what to fix first, and which exercises actually help. In my experience, knee pain only disappears for good once you fix these hidden causes. So if you want to build strong knees that you can rely on, get the book and subscribe to the channel. And if you're wondering when it's actually safe to run again without overloading your knee, watch this next video because I'll show you the 5 criteria that tell you exactly that. See you there.